Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and you can call us and get a free book right here, right now at 866-870-5752, and you also get to speak to Dr. Darrow. And the book is Dr. Darrow's latest, called Stem Cell and Platelet Therapy, Regenerate, Don't Operate.
Thank you, Nita.
You're welcome.
I want to talk about a couple of other things. Debbie, you're still with us, right?
I am.
All right, good. Hang with me just a minute. So number one, I'd love you to call in. We don't want to beat up Debbie too long here. And the phone number, to the studio is 866-870-5752. If you want to catch me at the office, it's 800-300-9300. And to watch videos of me on my website, that's www.lastemcells.com. And this was a freak thing that just happened when we went to break, and I swear to God this is true. I picked up my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, just to flash through it, and it popped open to the page on hip pain, which is what Debbie has been having issues with hip surgery. And then I saw on the bottom of page 86, and by the way, if you do call us, I will send you in and pay for the postage. I'll send you a free copy of this book. It says terrible side effects. I want to read this. Just be patient. Unfortunately, too many patients come to me after a hip replacement.
I can't hear you anymore. On my phone.
Well, you can just bear with us, so I hope everybody else can.
Oh.
Unfortunately, too many
I'm
patients...
still on my phone.
Debbie, can you hear me?
Yes, I had my phone turned down. But I really want to give you a big compliment because you explain everything so well that everybody can understand.
Well, I try to. I'm a simple-minded person.
Everything.
Debbie, let me read what I want to read here from the book, okay?
Okay.
Thank you. We'll get to you soon. Hang with us. We love you. Okay. Unfortunately, too many patients come to me after a hip replacement. This is in my book, okay, page 86. Or other elective surgery. I highlight elective because elective means the patient gets to elect whether they want to do it or not. It's not an emergency. The doctor doesn't say, you have to do this or you'll die. It's elective, which is what your surgery was, Debbie. It was elective. The most recent disaster is happening to a very old friend of mine. He is 65 years old, had both hips replaced for osteoarthritis a few years ago. I previously told him not to do the surgeries and that he didn't really need them. We had dinner last week and he told me of an odd situation that occurs around his surgical scars. Originally, the scar and surrounding tissues became red and swollen. None of his doctors can figure out why. Allergy to the prosthetic metal, plastic, or glue inside his body? With a question mark, I write. I didn't pay much attention since it didn't sound that bad. 2 nights ago, he sent me photos of a recent outbreak. The area of redness and swelling was about 4 inches by 8 inches. I told him to go directly to the ER since it looked like an infection. He was told at the ER doc that he didn't know what to do and that my friend should see a dermatologist. That's a skin doc. Unfortunately, no derm was available for days in the rural area where my friend lives. I'm on pins and needles waiting for the diagnosis. So I was very upset. I had trouble sleeping, to be honest with you, and to see if anybody could figure it out. He wasn't there with me to help him. He lived in a rural area. My guess is that my friend will have to have his prostheses removed and replaced with another material with the hope that the, in quotes, allergy will not return. To me, the skin looks so inflamed that if no infection was present, it certainly could occur any time. I've not told him yet what I'm thinking, because I didn't want, this is funny. I've not told him yet what I'm thinking, and I'm glad this book will not be published for him to read for a couple more months. I was in the writing stage. I'm not going to implant you with terrible stories of what I've seen after surgeries on many different parts of the body. Since the time I became involved in surgery in 1989, I have seen more bad outcomes than I care to remember. And let me make it clear that I respect surgeons for the difficult and complex work that they do. To me, they are the masters of medicine. Not many of us are willing to bear such standards and responsibilities. However, I must say, in my humble opinion, most elective surgeries should not be done. The risks are just too high. Now, how did that happen that I'm flashing through the book and that page opened up? I don't know.
Yeah, that's pretty amazing.
And to be honest, I haven't read my own book in a long time. And this shows me that I'm going to go back and reread what I wrote to help people on the radio show, because this is the place where I give the most information to the most people. And we have thousands and thousands of people listening right now. And this book is an amazing book. I mean, it's not because I wrote it.
Wait, is it not out yet? Or is it?
No, it's out. It's been out for a few years. But what I just read was before it had been printed. It was when it was in the writing stage. And it's got all of these studies on how regenerative medicine using stem cells and platelets work. People, surgeons say there's no research on it. Well, that's nonsense. There's so much research on it. And then they don't believe in it because they're trained in a different culture. And it's got studies on why surgeries are not good for us. There's so many surgeries that are done where there's a comparison with a fake surgery where the patient doesn't know if he's getting a real surgery or fake surgery. They'll cut the skin, the top of the skin, and put a suture in it, but they don't go into the knee as an example. Well, guess what? The people with the fake surgeries do better than the real surgeries down the road. What does that tell you? It tells me not to get a knee surgery. Anyway, Debbie, God bless you. You've given us a lot of food for thought here. I'm sorry you are having
very much
back pain after your hip replacement, but it's so common that I see that. And a lot of hip replacements are done when there isn't even a big deal going on. There's some arthritis, the person has pain. But guess what? The pain's not even coming from the hip joint. It could be coming from the greater trochanter, where all of the butt muscles attached to. There's just a lot of things going on that the surgeons don't find out because they don't touch the body. They get an image. It makes me mad. I'm sorry. If you're going to be doing surgery on somebody, you better do a great examination to find out where the pain generator is. I had a shoulder surgery I never needed, and it made me miserable for years. So I'm sorry I'm upset about all this, but it's true.
No, I'm going to call.
Thanks, Debbie. Appreciate your call.
Okay, thank you very much. Okay, bye.
So
Bye.
for you guys who have just listened in now, the phone number to the studio to talk to me is 866-870-5752. And if you want to catch me at the office or get more information we don't talk about, you can call the office at 800-300-9300. You can all watch videos of me doing these procedures if you want to see it's something you want to do. And that's on my website at www.lastemcells.com. I'm going to go to Rick, Nita, if that's okay with you. But Rick,
Sure.
hang with me 1 second. One of the other things we do in the office is to regenerate. I do the musculoskeletal regeneration, but we can also do the facial regeneration to regrow the collagen in the face to make people look younger. It's called the vampire facelift. I don't think you'll forget the name of it. We take the cells from your body, the platelets, the PRP, or the stem cells, and we put them into the face. We numb it up first on the face, and it's a very quick procedure. These procedures can also be done on the top of the head to regenerate hair. If your hair is thinning, it's not going to work a whole lot if you're Dr. Phil. So Rick, let me see what's going on. His clients tell him that doctors want to operate and they're scared of surgery. Whose clients? Your clients?
Yeah, it's a client of mine, but I'm in real estate, but they've been clients for years.
Okay.
And unfortunately, she had a slight auto accident, and they said there was nothing wrong with her neck, but she's had pain since then. But it's all knots in her back, lower back. Her hands are swelling up, all kinds of things going on.
Yeah.
And they keep saying, "Well, we're to operate." And I've been listening to you for several months on the radio, and I keep going, I got to tell people about you, and they don't call. And it's like, well, maybe I'm saying it the wrong way because they won't listen to the radio.
Well, listen, you're fighting
Well,
you're fighting an upstream battle here, because the number of guys who do regenerative medicine is small compared to the number of guys who do surgery, and surgery is the culture of this country. I'm going to tell you another story about that, okay? There is something different. It's for heart disease. It's called EECP. Write it down. Everybody should write this down. EECP, extracorporeal counterpulsation. It's a very simple procedure where you lay on a bed and there are things that are put around the legs that pump when the heart is at diastole, when it's at rest. And it pumps all that blood from the legs, which is like 60% of the blood in the body, back up through all the coronary arteries and literally blows open all of the vessels that are not being used. They're called ancillary vessels. So when people get clogged vessels and are ready for a bypass surgery, okay, most of them don't need that. But in our country, surgery is the first thing done. In other countries, like India is huge on EECP. They get EECP. Surgery is the very last thing they do. So everything is backwards to me in medicine in our country because, as Nita said, follow the money. America is very money driven, okay? We're capitalists. I'm not against that. I'm just saying when it comes to medicine, you can't let that drive your decisions. And unfortunately, it's a surgical society we live in. When I send my patients to a surgical consultation for informed consent, I hear this every single time. The patient comes back and says, the surgeon says I need to have immediate surgery, and I don't want it. And we do regenerative medicine using PRP and stem cells, and they don't get that surgery in most cases. Some people do because they give up before they're healed. This is not a magical cure. But let me tell you, surgery certainly is not either. Too many bad side effects. At least if my work fails, it's usually the patient's fault, and there's not anything terrible that happens. So, you know, the society is changing. There's more and more doctors learning regenerative medicine. There's more and more courses on it. I'm going to build a course on it myself that I can give to patients and to other people just looking on the internet so they can realize that surgery is really not the best thing for them except in certain cases. So, and you know, you told your clients, your real estate guy, you told your clients not to get surgery, but all they know is surgery because that's what's done. Yes. You know, it starts in high school. My daughters were athletes, and all of them wanted surgery when they got injured. I said, you're not getting surgery. They go, but everybody's getting surgery. I want to do it. No, you're not going to get it. They're fine now. I've done regenerative medicine on them.
Well, that's the best part of hearing about it because of hearing and seeing people over the years that had surgeries. And then to see just exactly what you talked about is the side effects afterwards that were far greater than the surgery, the problems that they started with. And so I keep listening, and I know I have a shoulder that really tightens up, and they have not. I go to massages, and they haven't been able to loosen it up either. And I keep going, maybe it's arthritis, something like that, building up in there. And
maybe it's not. And maybe it's nothing at all. Maybe it's just a sprain. Who knows? But if you want to come in and I'll examine it, it's 800-300-9300, 800-300-9300. That's the number to my office. I'd be glad to check it out, Rick. You sound like a great guy, and get to the bottom of it. I'm looking for the pain generator. I'm not looking at the images as the main thing. I do look at images because it's possible to miss a cancer, lymphoma, or something weird like that. It does happen, and I've seen it a few times in my practice. So even though I tell everyone I'm not going to treat you based on your image, I make every patient get an image because I don't want to miss that wild thing out there that could be a problem.
Yes, yes. Well, thank you, doctor. I will do that. I do have your number. I actually pulled over today, finally, to write it completely down the right way.
Yeah,
and,
thank you.
Also to look up your website that you gave. So
yeah, I mean the website's
the
website's amazing. I mean it changes people's lives when they look at it, and they see how easy it is to get the injections and then walk out of the office. You don't even need someone to drive you there.
That's great. That is great. So I will make that phone call. Thank you so much for being on the radio.
Sure.
And,
thank you so much for calling.
Live our lives longer.
Yes, thank you. And I do want to say, this treatment I do of regenerative medicine using your platelets, PRP, or stem cells is not a panacea for everything. I get calls every day. Will this heal my arthritis? Will this heal my cancer? Will this heal my multiple sclerosis? I don't know. I don't do those things. The arthritis part I take care of, but I don't do disease. I don't take care of that. There's a lot of stuff on the internet where a lot of doctors are saying they do that, and I don't believe in that yet. I think someday we'll be there. I don't think we're there yet. I just have to be honest, and I can't guarantee anybody with any form of medicine that it's going to help them. You've got to try things and see if it's for you. And that's what I do. I experiment all the time on my own body. And if it works on me, then I have other patients try it. And that's how I got into regenerative medicine with my own injuries. I self-injected myself, and after I did enough of it that I was convinced it worked, I started asking my patients if they would mind if I could try it on them, because not many people had heard of it back then. And most people did not want to have surgery. Monica, we're waiting on you, right? You're still there with us?
Yes.
Okay,
yes,
you've got.
I'm here. How are you, sir?
I'm good. You have right hip pain, I guess, huh?
Yes. My right hip has arthritis, and my doctor's saying that it's like bone to bone.
Okay.
And he took my right leg. I can't walk on my right leg.
Okay.
And it's like an aching pain all up into my groin.
Okay.
So he took my leg and twisted, but he only could twist it, and that's so much, and that's the pain. So they did a X-ray. They saw the arthritis. Then they went and did pull fluid off my hip to make sure, because I had cancer before, and I had back surgery, and I had an infection in my spine.
Ooh.
So they test that. I'm sorry.
Okay. So you've been through the mill, and now you had a back surgery that is not working very well for you. You had an infection. Is it feeling better now?
Yes, actually, my back is perfect. I had that a year ago.
Okay.
What I'm dealing with now, the arthritis is settled in my right hip.
Okay.
And
Are you able to move your
saying
leg? Are you able to move your right leg?
A little, not a lot. I can't lift it. It's like a heavy leg. It's like
Okay.
it's heavy.
So I would have to check it out, because I don't know how much of that is just due to the pain or how much is due to the arthritis, and they may be related. But I will say this, I get patients in every single day that have what looks like terrible arthritis, but they don't need a surgery, and we can get them healed. I'm not telling you I can do that for you. I have to examine you and see what the story is. If you want to come into the office, the phone number is 800-300-9300. We can do a quick look, and I'll look with the ultrasound, see if there's still fluid in there. I like the ultrasound to look inside the body because it's sitting right by the bedside, and I don't have to send you somewhere for an imaging. I can just take a quick look inside, and we can move you around under ultrasound and see what's going on also. So I don't know what to tell you yet. I know that from what you told me, I'm not convinced you need a surgery. I might tell you need one after I'm done looking at it, but most of the time people don't need a surgery. You may be one who does. I don't have an answer till I examine.
Mm-hmm. Okay. Well, with the pain in that my right leg, and like I said, the pain goes from my groin up into my hip. And they did say that my cartilage is gone.
Okay, well,
Right.
gone and
Okay,
gone
yeah.
are two different stories, and I'm being facetious.
I'm sorry.
But I hear patients every day go, my cartilage is gone. And I look and I see there's plenty of cartilage there.
Mm-hmm. Mm-hmm.
So the
That's-
definition of gone is disputable. The examination is going to be what tells me what's going on, not your image, not the x-ray, not the MRI, not the CT scan.
Mm-hmm.
Because I'm often surprised. People come in ready for a surgery. They've seen orthopedic surgery, and they say, I have to have a surgery. I have bone-on-bone arthritis, and I do an examination, and they have very good range of motion. They have some pain, and I tell them, you may have arthritis, but you don't have bone-on-bone, because then the bones don't move.
Mhm.
And we get them better using regenerative medicine of platelets and stem cells. So I can't tell you much right now, Monica, about your story,
Right.
because I need to touch it and move you around and see what the reality is.
I understand.
All I can tell you is I wouldn't just jump into a surgery until you have a doctor check you out who's not surgically minded, because you get the same opinion
Okay.
from the same kind of a doctor over and over and over and over. That's their culture.
Mm-hmm. Mm-hmm. I know they sent me to my back doctor that did my back surgery. They sent me to the surgeon that I went to, Dr. Birmingham, for the arthritis that had settled in my right hip.
Yeah, I understand everything you've told me, and I'm sorry you're going through all this, but I can't tell you anything definitive unless I examine you.
I
People
understand.
send me x-rays from all over the world, MRIs from all over the world. They email them to me and say, am I a good candidate? And I go, I can't tell from the image. That doesn't tell me anything. You've got to come in and be examined, and you're that particular case.
Wow. Great information. This is awesome.
All right, God bless you, my friend. I'm so appreciative of you making a call.
Thank you, Monica.
Thank you, sir.
A lot of hip issues today.
Today's a hippie day.
It's
And
hip
I'm an
day.
old hippie from Berkeley, so I like it.
Oh my gosh, that's way before my time.
Well, it's fun being a hippie. So I'm going to do a question here because this is not just all about hips.
Yes.
Here is one on, what is this? Shoulders. I have issues with both shoulders. That's not me, that's somebody else. I have issues with both shoulders that I like to address. I've had PRP done in the past, and it offered some temporary relief. I now want to try stem cell therapy on them. I think that's smart. I don't know who did the PRP on you, but some guys will, the orthopedic surgical model is you do one injection, and that's a failure because the shoulder is so complex. When I do a shoulder, I'm going to do the joint, I'm going to do the labrum, I'm going to do, look with an ultrasound, I'll do the infraspinatus tendon, the supraspinatus, subscapularis, and all the areas around the shoulder that move it, and those are called the rotator cuff tendons. And the subdeltoid bursa is often a big pain generator, so we look with the ultrasound, see if there's fluid in there. So shoulders are a very common thing that I see. Every day I inject shoulders, but I do all parts of the body. There's nothing I don't really do. So I have to examine this person just like everybody else to see if I can help them. The fact that PRP helped a little bit before means that there's a very good chance I could do a better job with it in the technique that I use and using stem cells, which are going to work with the platelets. I mix them together and do a more effective job. And I'm going to go to, let's see, here's one. Stem cell therapy for knees. Let's see what this person says. Would like to know more about stem cell. I'm thinking about having it done on both my knees. Make an appointment for consultation. A client of yours gave me your number. Thank you. Yeah, we do lots of knees every day. We do lots of everything every day. God bless you all. Thank you, Nita. You're a great host. You can call my office at 800-300-9300. You can go to the website and watch me doing videos of these procedures, www.lastemcells.com. Thank you, Alex and Suzette and everybody else. God bless you.
And thank you, Katie. And listen to our pal Warren Eckstein from 11 to 1 every
You've been
Saturday.
listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.
Thank you all.